Hi all, welcome to nursing lectures. So today we are dealing with new topic, very important topic in medical surgical nursing exam, that is gout. So what do you mean by gouts? Gout is a metabolic disorder of purine metabolism. So moving to the definition, gout is a metabolic disorder involving purine metabolism leading to increased uric acid levels in the blood. Excess uric acid form crystals that deposit in the joints and tissue, triggering the inflammation. So it is very common in a woman means that mostly affect postmenopausal women, especially those during diuretics. Then also men are also commonly affected. So what do you mean by gout? Gout is a metabolic disorders of the purine involving purine metabolism. So due to this, it will lead to increase the uric acid in our blood level. So excess uric acid form crystals and it will deposit in the joints and tissues of the bones. So moving to the causes and pathophysiology. Gout happen when the body either produces too much uric acid or fails to eliminate it properly, causing crystal deposit in the joints and surrounding tissue. So due to the overproduction or under excretion. The overproduction due to genetic enzyme defect or blood disorders or psoriasis or chemotherapy. Then under excretion like kidney disease, endocrine disorders or certain medications. So the pathophysiology is produce too much uric acid or fails to eliminate it properly. In kidney diseases or endocrine disorders, the body cannot fails to eliminate it properly and causes the crystal deposit in the joints and surrounding tissues. So moving to the signs and symptoms or clinical manifestations of gout. Acute gout. In acute gout usually affect one joint at a time, often the big toe called podagra, though women may have multiple joints also involved. The symptoms may intense joint pain, redness, warmth, swelling, and sometimes fever also seen. Sudden onset is usually in acute gout attack. Severe pain also seen. It lasts for 3 to 10 days without any treatment. I will show the picture of podgara. That means excess of crystals accumulated in the joints. If the excess crystals accumulated in the big toe, it is called a podagara. I have said that that is podgara. That is first metatarsopharyngeal. So I have already mentioned that toffee and podgara. This is in the big toe. There is a swelling on the joint. We can say that is called a podgara. The swelling on the Achilles tendons also can be said. What is that is called toffee. So this is the image of toffee and podgara. Then next one is chronic gout. Chronic gout, tophus gout, occurs if gout is untreated or poorly managed. If the gout is poorly treated in acute stage, not treated properly, it may lead to chronic gout. The uric acid crystals form lupus called toffee in joint, skin and soft tissue. I will show the picture of toffee and it can lead to joint deformity and damage similar to rheumatoid arthritis. So what are the clinical features of acute and gout? In acute, it may be sudden and severe joint pain may be seen, swelling, redness also seen, and it usually lasts for 3 to 10 days. So in chronic gout, formation of toffee is in prolonged arthritis with the deformities, and there is also one classification, that is asymptomatic hyperuricemia, that is high uric acid without symptoms, risk of kidney stones and nephropathy. Then moving to the diagnosis, medical history and physical examination. First, we should write in the diagnostic examination is history collection and physical examination. That joint fluid analysis under microscope for to identify the urate crystals, and blood test for uric acid levels like ESR elevated usually shows inflammation markers. Then 24-hour urine test to check uric acid production and excretion. Then X-rays to look for joint damage in chronic cases. So this is about the diagnosis of gout. Then moving to the management. During in acute stage, we should rest and elevate the joint. Also, you can apply cold or heat packs to reduce the inflammation. Then NSAIDs for pain and inflammations. Then colchicine or IV for acute symptoms and prevention. Then corticosteroids. It is injected into the joint or taken orally and increase the oral fluid intake. Then management of chronic gout. The long-term management in the chronic gout. Medications to lower uric acid, that is allopurinol. Then probenecid increases the uric acid excretion. Then monitor uric acid levels and kidney function. Then next one is the lifestyle changes. Maintain a healthy weight, avoid alcohol intake, limit purine-rich foods like organ meats, shellfish, or sardines, etc. like that. Then what are the complications of gout? Kidney stones, that uric acid calculi, chronic kidney disease, nephropathy, and joint deformities and bone erosions. Moving to the nursing care. As in is what we can do to the gout patient. First one, nursing assessment. Check history of risk of factors like alcohol use, kidney issue, medications. Then examine joint for pain, redness and swelling. Next one is look for toffee, that is common on elbows, Achilles tendons, etc. Then what are the nursing diagnoses? Acute pain related to joint inflammation, limited mobility due to joint discomfort, and knowledge deficit about the managing gout and medications. These are the possible nursing diagnoses you can write. Then nursing interventions. Administer pain relief as prescribed. These are the common interventions. Then encourage hydration, support mobility while protecting affected joints, educate about medication, side effect, and lifestyle changes. Teach avoidance of gout triggering food and substance like organ meat, etc. Then stress importance of follow-up. So next one is the patient education. What are the education we can given to patient? Nature of the diseases and treatment importance we can educate about that. Then need for lifelong medication in chronic cases. We should educate the patient about the need for the lifelong medication in chronic cases. Then what are the signs of allopurinol hypersensitivity? Then importance of avoiding crash diets. Also educate the patient to avoid purine-rich fruits and promote treatment of acute attacks. So this is all about the purine disorders of purine metabolism, that is gout. It is very important topic in medical surgical nursing. Okay, if you found this video useful, like, share and subscribe. Also comment down which topic do you want in the next video. Thank you.